plants. We are the experts who harness it and deliver it to you. We are the Powering America team of Northwest Indiana, the best trained, most skilled, and safest electricians in the world. The very definition of value in every job we do. For your next project, go to certifiedelectrician.com.
St. Nicholas Byzantine Catholic Church in Munster is proud to celebrate Divine Liturgy on WJOB. Join us every Sunday on WJOBnetwork.com, as well as AM 1230 and 104.7 FM at 8:30 a.m. We return to in-person church with only an 8:30 liturgy. Liturgy will continue to be broadcasted as well for those who are sick or do not yet wish to return. Be safe and see you in church.
This is Christian Flores, and you are listening to WJOB 1230 AM and 104.7 FM in Hammond, Indiana.
Let your soul and spirit fly into the mystic. And where that foghorn blows, I will be coming home. Yeah, when the foghorn blows, I wanna hear it. I don't have to fear it, and I wanna rock your gypsy soul, just like way back in the days of old. Yeah, magnificently we will fold.
Yeah, you know what? That's perfect. That's a random bump right there, but it's perfect for this St. Patrick's Day week. Van Morrison right there. Tony Panic, WJOB AM 1230, 104.7 FM on the radio, also on the TuneIn app as well. Listen anywhere throughout the world with that TuneIn app. Now on video, jedtv.com, Amazon, Roku, Apple TV, your Jed TV app, and even Facebook Live here at the moment, with good reason, because we got a special program right now. Usually Jim Dietlow sits here and talks to the good doctor, but I got the specialty today to do it. So let's see if we got him in here right now. Dr. Kondamuri, are you there?
Yes, I'm here, Tony. How are you?
I could hear you loud and clear there, doctor. It's good to have you on here today.
Tony.
It's good to have you here with me today. Again, I heard of you from time to time. You're a pretty popular guy here in the region. Of course, this is a sponsored show from Spine, Midwest Interventional Spine Specialist. That's where you're located at right now, right, Dr.
Yes.
Sean?
Yes, that's where I am. That's my practice. It's Midwest Interventional Spine Specialist. We're in Munster and in Munster, Dyer, Hobart, and Chesterton.
Now, should I call you? What do you like to be called? Dr. Kondamuri, Dr. Sean?
You can call me doctor. That'll be good.
Doctor. We'll do it, doctor.
Yeah. Call me Dr. Sean, whatever you want. Dr. Kondamuri, whatever you want.
And again, I listen to the program from time to time, but you're a local guy as well, aren't you?
Yes, I lived in Munster for 15 years now. I live in Dyer. I've been living in Dyer for the last 10 years.
How's things going in Dyer?
Great. You know, my kids still have got my last child still goes to Munster High School. So I've been very much in the Munster school system, but in Dyer, I just involved in Dyer as well.
Talk about what you guys do over there. Again, I know the spine is a very important part of the body. What do you guys do over there at the Interventional Spine Specialist Center?
So yeah, we're spine specialists. So we provide mostly non-operative sciatica for back pain and neck pain. Typically spinal pain, back pain, neck pain, but also other pain conditions like neuropathies or sciatica or disc herniations or spinal stenosis. And we have a number of different treatments that are minimally invasive, different procedures, different injections, different nerve destruction procedures. We implant different devices, all with the intention of reducing pain or eliminating pain completely when it's possible without doing a big surgery.
How many doctors are on standby there?
We have 5 doctors. There are 5 of us, myself, Dr. Desari, Dr. Gupta, Dr. Savine, Dr. Nikhil Shetty.
And you bring up a good point, too, without surgery, because I think a lot of people sometimes, they got a pain in their back or their neck and like, oh, no, this requires surgery. But sometimes that's not the case, is it, doctor?
Most of the time, it's not the case, Tony. Most of the time. Actually, 70% of patients should get better by seeing their chiropractor or their physical therapist or just doing home exercises. The remaining 30% might end up going to me or a surgeon. And typically, even those patients don't need surgery. I mean, I would say that less than 10% of the remaining 30 would actually need surgery.
We live in a day and age of, past year being on Zoom. A lot of times you're sitting there at the computer and you're kind of just slouching. And I get this sometimes too. I feel like I'm just slouching too much. There's a correct way to sit in a chair, isn't it?
Yes, absolutely. And not only the problem I see with Zoom calls, and I'm on a lot of Zoom calls myself now with different educational things and different societies I belong to. So the worst thing is, it's on your neck. If you're looking at the screen, it tends to really hurt your neck, especially if you wear bifocals. If you're around my age, your eyes are a little worse. You end up looking at your screen like this through the bottom of in many cases, people have bifocals. So they're looking to the bottom of their glasses. And that puts a little bit of an extension on their neck. And that extension on their neck can really cause chronic neck strain, chronic upper back strain and pain. And if this goes on, it's gone on for a year now, right? A lot of people are just literally working from home on their computers all day long. So naturally, we're going to see different ailments like that. It's not good.
Now, you see me right now on the screen there, doctor. This is how I normally sit. Am I doing something wrong here?
Yeah, you should sit more upright, and you probably want to have a little support in that chair.
Okay.
Yeah, even that's okay. I mean, just as long as you've got some kind of lumbar support, your upper back should be up against that chair. And the chair should be locked so it's not completely reclining.
Okay.
Unless you want to recline to rest. But if you're sitting and working, you want to be sitting somewhat upright with some lumbar support. If you could put your feet up on top of a step stool of some kind, something to raise your feet up a little bit, so your knees are just slightly higher than your hips, that's also sometimes very helpful. We don't always want to have our feet on the ground.
That's interesting. Would you say posture is the number one cause of back pain out there? What is the leading cause of back pain?
I think posture has a lot to do with it. I don't know if that's the number one cause, but it certainly contributes to all the most common causes. And a lot of it has to do with just less, people aren't exercising enough, they're deconditioned. And then if you take a deconditioned body or deconditioned spine and you give that person bad posture all the time, well, then naturally you're going to be at risk of having painful problems coming out of your back. But also, like a lot of people in the region have jobs that are pretty laborious. They do some physical labor, and if they don't use the right posture or the right body mechanics to do these things, to lift things or to bend and operate some machine or device, well, naturally you're going to put a lot of stress on your back and potentially blow out a disc or something.
Lifting, a big thing. What's the old saying? Lift with the knees.
Lift with the legs.
Legs.
Use your legs.
The legs. Okay.
And that's important, actually, Tony, not just for lifting a heavy weight, but even if you drop a pen on the ground, you want to bend with your knees and pick up that pen, because it's not the weight of the object; it's the way you're deflexing your spine that causes you the problem. It's better to go down with your legs, with your back sort of straight, and come right back up.
I'm sure everybody's different, but I mean, what's the procedure? I get people have to visit you to get all the details here, and get it checked out because everybody's different. But what is the basic thing? It's just chiropractor, or is it massages? How do you get that back and neck up and running once again?
Yeah. So the first thing is you're going to see your primary care doctor probably. You hopefully aren't so severe that you have to go to urgent care or to the hospital. You don't want that. You want to get to your primary care doctor. And then if you have a chiropractor already, see your chiropractor. If you have a physical therapist already, see your physical therapist. And they will get you going on a particular program. And they will kind of increase the range of motion in your spine and hopefully relax some of those muscles with some simple maneuvers. And hopefully that gets you going again and you go back to your exercise program. The biggest problem, Tony, you're a young guy. I mean, you probably don't have to face this problem, but there's a lot of guys who are your age, like millennials, who are really out of shape. They're just not exercising. They're deconditioned.
I don't have that problem, doctor.
I can see you don't have that problem for sure.
Yeah. Continue on there.
No. I mean, fitness is so important. I mean, a lot of my conversations with my patients are all around fitness. And for example, simple things like leg strength. The strength in your legs determine, in many cases, your future health. If your legs are weak, if they're deconditioned, if you've lost muscle mass, and you already have arthritis in your knees, hips, or ankles, and you're on the ground, you're oftentimes not even going to be able to get up. Not your age group, but like my age group or older, they have a hard time getting up off the ground. And if you can't go down to the ground comfortably to enjoy life with your grandchildren or whatever else you're doing, or to work in your house because you're afraid that you're not going to be able to get up again, naturally you're going to avoid doing all those things that are kind of pleasurable in your life. So those muscle imbalances and asymmetries are very common. And if you're anywhere over the age of 40, you have a high risk of loss of muscle mass and joint and bone joint and arthritis type problems. And all of this leads to potential balance issues and falls. And if you fall, you're going to be at risk of having a problem if you fall enough times, if you fall the wrong way. So we want to avoid people from falling. Leg strength is super important.
It's funny because you talk about the weight issues, and the other day I was looking at the BMI chart that was like made in was it made in 1950s?
I don't know. It's been there for a long time.
But it hasn't really changed. So I'm wondering, do they have to rearrange that now, or should we be getting back on track to follow that chart? Because back in the 1950s, our portions were so small.
It should be updated a little bit.
Mm-hmm.
I mean, but the problem is, yes, it should be updated, but we don't want to say, well, everybody I see right now, every person I see who's let's say 5'10", seems to weigh around 200 pounds. So that means, well, maybe we should we should modify that scale so 200 pounds is normal for a 5'10" person. That's not right. I mean, that patient's overweight. Mm-hmm. You have to accept that maybe you are overweight and you need to, kind of know where you should be. And if you don't know where the normal range is, and now you've skewed your normal range so it is higher, well, that's not fair to the person. I mean, because they're going to start accepting where they're at. And I think that happens already. People accept that, well, this is my normal weight, or I'm big boned or something like that.
No, for sure.
And they accept being a little bit overweight, and being overweight leads to lots of problems.
Well, especially in this day and age of the last year with COVID and everything, people have gone one of two ways. They either got really healthy, started going for more walks outside, or they kind of got lazy in quarantine, started eating more and not doing too much. So you probably talk to people on both ends of the spectrum there. Have you noticed this past year, was there a trend this past year of people leaning towards a certain way, or was it like years past, or was this year different?
So I think you nailed it pretty nicely there in what you said, Tony. So the pandemic, this last 1 year of the pandemic is really, I want to say, in some ways has darkened the spirits of a lot of people. It's made people rethink what's important in their lives and what makes them really happy. And for some people, that means, well, I want to get back into fitness. I want to eat well and exercise and figure out a way to come out of this pandemic feeling strong and healthy. And for others, it might be on the other end of the extreme. It might be that I feel a little anxious and depressed, and I've kind of given up, and I eat more, and of course I can't exercise because I can't go to my gym. I can't do anything. I'm feeling a little sad being at home. And in some cases, you have issues with loneliness and depression. So naturally, that person's going to be very reticent to do anything that might be good for them. So the issue here is, I think, hopefully most of your listeners have sort of found a way to rethink what was important in their life and what really makes them happy. And they take this sort of renewed sense of happiness and gratitude for simple things in life, and they carry that on post-pandemic. But what happens, right? I mean, a lot of times, we fall back into our old routines, our old habits. We get caught up with our busy lives, and we go back to the old ways of doing things. So hopefully you maintain and improve upon all the good things you did during this last 1 year, instead of going back to the habits in your life that were probably not ideal.
It's tough to do sometimes as we're coming out of the winter months here, and a lot of times people stop walking outside, stop running outside, stop biking outside. Are you a biker yourself, Doctor?
I am. I'm a cyclist, yes.
Now, are you like one of those guys that puts on the jumpsuit and gets out there, or are you just kind of a casual biker?
I'm that guy. I like to go out there and go for long rides.
Really? Okay.
I'm looking forward to it in another few weeks.
Yeah, no. So I know a lot of people are looking forward to that. Me, I have a bike, but I'm not one of those. Well, you know what? I'm gonna put my jumpsuit on, my helmet on, and just kind of go as fast as I can on a bike trail. I'm a leisurely biker, I should say there.
That's good.
As a working out, I'm a leisure workouter.
That's good. That's fantastic. I mean, you're a good model for your listeners, because we have to exercise, we have to maintain our fitness, and we have to improve our fitness. Fitness should be a priority. With physical fitness comes intellectual and emotional fitness. I
agree too. But as it gets warmer out here, biking stimulates the body, as you say, stimulates the mind. What about people that are thinking about stuff like that? Like, you know what? It's been so long. I haven't been on a bike in years. I can't do this. What do you say to folks out there are kind of down and out about physical activity? Because there's a lot of them. It's hard to. I think the hardest part is getting to the destination, getting to the gym, getting on the bike. But a lot of people can't go past that first step, Doctor.
It's hard. I mean, it's definitely hard. But the person who says that has to realize that problem is with them. Because if the weather's good, you can get outside and walk. Now, certainly some people have limitations, right? Some of my patients are just really limited. They literally cannot walk, or they don't have the means to even get outside because of some medical problem, a cardiac problem or a pulmonary problem. They might be on, oxygen 24 hours a day. So if we put those patients aside or those people aside, everybody else has the ability to get out and walk. And it is a matter of somebody reminding you of that and encouraging you to do that. And also, what's unfortunate is that if you look at happiness, Tony, happiness as a byproduct of life, everybody wants to be happy, right? And in America, our salaries on average have actually gone up in the last year or two, in the last 10 years at least. It's gone up in the last 10 years. What people earn and the lifestyle that people live have probably improved in the last 10 years. But you might not be surprised to hear that the happiness level in America has not gone up.
Interesting.
It's actually gone down a little bit. If they compare like happiness in there's studies done every year where they ask a random sample of Americans, a random sample of Norwegians, of Britishers, and different countries all over the world, and America ranks like 20th on the happiness scale.
Wow.
And this is a country where everyone's got a cell phone, almost everyone's got a car, almost everybody is living under a roof, and despite the fact that we have poverty in America, the majority of us have something to eat. We have clothes on our back, and yet we're 20th in the world for happiness. And the countries that beat us out in some cases have way less than we do.
So the old saying's wrong. Money can't buy happiness.
Of course it can. You know that, right? Money to at a certain level, you need money to have some happiness. You've got to be able to afford certain basics in life. But we know for a fact, right? If you look at like multimillionaires and billionaires, and I know some of these people, they're the most miserable people in the world. And they have more money than they or their families can ever spend, but yet they're miserable. And sadly, look at like some of the people who died in the last few years, right? Who committed suicide. The biggest example was, who am I thinking of? Robin Williams.
Yes. Yep.
Right? He had fame, he had money, he had, people who loved him. He had a skill, for telling jokes and humor that made people happy, yet he was not fulfilled. He was not fulfilled and he didn't live. So why did we get into this? Okay, so the reason we kind of got into this happiness talk is sometimes it's not money. Sometimes it's just getting out there, walking outside, looking out your window and watching deer in your backyard that are sort of while you're sipping on a cup of nice coffee or tea and you're watching some deer outside for 5 minutes, kind of enjoying their own lives. That's happiness. You have to find things like that make you happy. Of course, having money helps sometimes, but a lot of the things that are really fun and happy and give you joy don't necessarily need a lot of money.
The littlest things sometimes, Doctor. The littlest things.
Yeah.
I don't know. Do you guys normally take a phone call here or two? Because we got somebody waiting. I don't know.
Yeah, put them on.
Okay, sure. 219-845-1100. Let's go to the phone lines, see what we got here. Caller, you're on the air.
Hey, Doctor. My name's Dave, and I've just been listening to you talk about happiness. And, it's really interesting because one of the afternoon hosts that works with Tony, people joke about him all the time because he doesn't smile and he seems angry a lot. And some of the callers in the morning are the same way. They're very unhappy. And so can you talk a little bit about how important having a good sex life is to your happiness and your health?
What? That might be after hours chat there, Dave. Thank you. Appreciate the call there.
It's a good thing to talk about, right? First of all, Dave, are you the Dave who called last time? Because
it might have been
third Dave who's called in.
Probably him.
No, I don't think so. I think it's a different Dave.
Doctor, you'll be surprised to know we have about 10 Daves that call into the station.
I've met at least 3 or 4 of your Daves.
There's at least 3 from Crown Point. There's 2, I think, one was from Highland, went to Gary. One's still in Highland, I think, and then there's Dave right here that calls in. So there's a lot of Daves out there, Doctor.
No, there's definitely a lot of Daves out there. So here's the thing. So especially with the pandemic now, how do we put this? So people have been dealing with being at home and being stressed in various ways and feeling anxiety and some depression. And we're coming out of this pandemic now. children, I mean, we've known for a long time that even 18-year-olds, a large percentage of 18-year-olds and most millennials have some sort of emotional difficulties. They might have issues with emotional well-being. And I feel like going forward, it is becoming such a almost a epidemic among young people that pretty soon in the workplace and at schools, it's going to be the responsibility of the workplace and the school to actually provide some services for these people who are dealing with these issues. Because on the one hand, if you're pregnant, your workplace has to make adjustments for your pregnancy and maybe give you time off. If you have an illness, there's some adjustments made for that. So similarly, if you have an emotional well-being issue, if you've got an anxiety or depression issue, your workplace pretty soon is going to be involved in taking care of that. Why do I say that? Because I think that going forward, just like the schools and the workplace are going to be involved in helping patients with their emotional problems sometimes, or at least addressing them and making adjustments in the workplace or in the school for that, you're going to have a lot of new things happening. To what Dave said regarding happiness, there's a number of little things you can do, and we can do them at home. But I think that pretty soon what's going to happen is in 10 years, our schools from grade school on, they'll begin to teach kids a well-being curriculum. Right now, we know a lot of things, but nobody implements them. Yeah. Something as simple as just at the end of the day, recording 3 things that you are grateful for, or 3 things that went well in your day, is writing it down in a journal or somewhere. Visualizing what's the best thing, what would be the best situation for you in your life. Even mindfulness exercises or meditation becomes really important. And to what Dave said, it's really important. I mean, having a relationship, and part of a healthy relationship is a sexual relationship. So if you have a significant other, that is, if they do not have a good relationship, a good intimacy between them, you're going to see problems with that relationship. It's hard to find 2 people who don't need the intimacy. Typically what happens is one person doesn't and the other one does. So that's that's sort of a problem there. They're going to butt heads, and there's going to be a problem, especially month after month, year after year, if they're not intimate. So sexual health is very important. But the most important thing that we found in studies with happiness is that having a social network of friends is very important. Having your health is very important, and having a purpose for your life. And that purpose, if you're older, might be just to help my children out with my grandkids. That might be a purpose. Another purpose might be I'm doing something good at work, and it's helping my company or helping people in some way, and I feel good about it. But the most important thing is having a social network. So, when guys go out and they hang out with each other, and women go out and they hang out with each other, that's what keeps them happy. Mm-hmm. When you don't have friends and you don't have acquaintances to people to hang out with, you're going to be unhappy.
Everybody needs a friend.
And why is this important? Happiness, the happier you are, the more successful you are going to be at your work, and the longer you're going to live. And these are facts. This has been studied. Happier people live longer. Happier people are more successful in their jobs and careers.
How about that? So be happy, and you'll live a long, happy
life. Be happy,
life,
don't worry.
Lives.
Remember that song?
Don't worry. Yeah, the old classic song, Don't Worry, Be Happy. I know we got another caller hanging in here, but I do want to get to this, because as the weather warms up, a lot of people are going to be going out there and maybe playing basketball, baseball, running around more. I like what Julie called it too. The weekend warrior injuries.
Yes.
So we're coming off a long winter here. People are starting to get back in the groove of things, but once you jump right in, it may not be easy, smooth sailing there. There are injuries that come with playing basketball. Or maybe you fall off your bike, or she said, the weekend warrior injuries. How do you guys take care of those weekend warrior injuries? Because I'm sure you're going to see a lot of them as the weather warms up here.
Most of the time when the patient comes to us with the injury, at that point, we're not preventing anything. We're actually treating it. I mean, depending on the severity of the problem, we're going to start treating them. If it's an injury like a sprain of some ligaments or some tendons in some joint, like your ankle or your elbow, that gets treated with just typical conservative care. If it's something that somebody has broken, if they've torn a ligament or if they've broken a bone, well, that's going to require orthopedic care. But before all of these things, hopefully we're preventing these injuries from happening. And that's why I like to talk about this a lot. And really, it's simple things. Just know your limitations, stretch a little bit, and warm up. Don't just jump. Remember, like you just said, you're coming off this cold winter. you're crazy if you think you're going to go out there and just, if you haven't played basketball, you mentioned basketball, if you haven't played basketball for 6 months or a year, and you go out onto a court and you're playing with some guys who are playing kind of hard, and you are not ready and you're not warmed up, that's a recipe for disaster.
And a lot of people do that there, doctor. They think, I could just jump right back in there. I'll be fine.
Right.
Not
even golf, even something as simple as golf. If you don't warm up after a long hiatus of not playing golf, you're going to potentially injure something.
How about bowling, doctor? Is bowling, you got to warm up for bowling too?
Bowling too. You can hurt your back when you're pivoting off of one leg, and a lot of stress is on your knee. If you do it just slightly wrong, you can injure your knee, you can tear your meniscus, and you can injure your back, even with bowling.
Ah, man. Yeah, you're right. There's a lot of work that goes into bowling as well. Hey, we're going to wrap things up here with a couple more phone calls. Let's take them right now. Caller, you're on the air.
Hey, doctor.
Can you hear him, doctor?
Tony had mentioned that there's a few Dave from Crown Points that call in. There's only really one Dave from Crown Point of any consequence.
This is a Dave from Crown Point here, doctor.
Must be.
At any rate, I digress. You mentioned mental health and overall mood of people and things of that nature. Let me ask you a question. My wife had recently went to our general practitioner and for a non-COVID related issue, and they got on the topic of COVID-19, and that doctor had indicated a good number of the cases he's been seeing lately are, as opposed to a physical ailment of some sort, it seemed to be more psychological related to corona. And I don't know if he didn't really elaborate. Maybe he meant people were dwelling on maybe things they thought they had, which they really didn't, because they had too much time on their hands sitting around doing nothing, dwelling on issues they may or may not have. So he said there seems to be a real uptick of mental issues that he sees here lately. In your field, you deal with the back, you deal with the spine, things of that nature. Have you seen an uptick?
Oh, yes, absolutely. And it's not just me. I mean, this is actually getting studied now. So, as we talked about during the pandemic, people are making lots of adjustments people are forced to make lots of adjustments because the government said so. And because of that, you are reducing your social contact. And when pretty much everyone is reducing social contact across every aspect of their lives, there's going to be, some of this is going to become permanent and chronic, and that's already happening. You got to remember, humans are social species. We're very social. Our brains expect proximity to others. We want to be near others, Dave from Crown Point. And if you are not in proximity to others, your body and your brain responds by putting out, kind of getting into sort of a heightened state of alert. And if you have to deal with things alone for too long, that heightened state of alert becomes more chronic and persistent. And our brains and bodies, when they're on high alert for a long time, is going to cause some wear and tear. It's going to cause some high blood pressure, so true medical problems, and it's going to cause some inflammation, chronic inflammation. But from a mental, emotional standpoint, it absolutely causes, issues that become chronic and they require care. So it becomes really important for everyone to, actively, intentionally seek out other people to be with. I'm not saying seek out doctors or psychologists or social workers to get treated. I'm talking about just get in front of people. Find your, when you are able to, if you're middle-aged or older and you want to see your children or grandchildren, when you're able to do that, let's get out there and do that. See them somehow, get personal, get in front of them once you're vaccinated or whatever it is, and have some true physical direct contact, because we're missing that. Many people are missing that. Zoom calls are great, but it doesn't replace, personal contact.
I'm a firm believer that you have to stay physical in order to keep your mental capacity as well. It could be argued that our current president doesn't exercise enough, and it's affecting him in that regard as well. But that's just an opinion.
Yeah.
Right.
But you're right. I mean, we talk about that a lot, Dave, right? In prior episodes, Jim and I have spoken quite a bit about the importance of physical fitness and physical activity and how that affects you emotionally.
It's the last phone call here.
Thank you, Dave.
You're on with the doctor. Maybe it's another Dave. We'll find out. Caller, you're on the air.
Hi, this is Rose. How are you?
It's a Rose,
doctor. Hi, Rose.
Hi. I have a question. I'll be 77 in November. I was physically active at a gym until, of course, last March. So I'm one of the ones that is eating too much and not doing enough. And I realized that at least what I could do is walk. When I was in Chicago, I walked everywhere, but I've been out here for almost 30 years and no walking. I jump in a car now. I learned how to drive, and I don't walk enough. So and I also have recently had bad blood circulation where I have to wear those compressed socks
Compression
now.
stockings.
Yeah. So my question is, I need to go out and walk. I know that. How much time or what is a good amount of time every day to walk, or how many miles to walk?
That's a great question, Rose. So there are guidelines for that. I'm going to tell you those guidelines in just a moment. But I want to also say, if you had not said you were 77, I could not have guessed that by your voice. Your voice sounds really strong and healthy.
Thank you.
Actually, it sounds young. It doesn't sound like a 77-year-old. So that's really good. You probably are using your voice a lot and you're talking, which is good. And would you say that let me ask you this first. Have you been vaccinated?
I have had both vaccinations, yes.
How comfortable are you getting in front of people wearing your mask? Are you feeling comfortable with that, or are you nervous?
Oh, no, I'm fine with wearing my mask. I mean, I go out to the stores and stuff wearing my mask and social distancing, so I'm fine with that. I live alone.
So where do you live, Rose? Do you live in a nice neighborhood where you can walk around outside?
Oh, yeah, I'm right over here close to Purdue. So I could go to Wicker, I could go.
So as soon as that weather gets warm, you need to get outside and start walking. And the guidelines are these are the government guidelines, which is what we also use. 3 to 5 days a week, 30 minutes at a time. So a total of 150 minutes a week. So if you say 30 minutes 5 times a week, that's 150 minutes of moderate exercise. So that means a slightly brisk for you walk. Walk a little bit faster than would be a casual walk in the park. And try to do that for a straight 30 minutes without stopping.
Okay.
If you do that 5 days a week, you're getting the basic minimum good exercise to get your blood flowing through your body, activating your muscles in your legs. And you can take a couple of blocks around, walk a couple of streets in your neighborhood. And by Purdue, you should be able to comfortably do that as long as you're healthy enough to do that. And then I would ask you to do even more than that. Once you've been doing that for some time, and that's easy, you want to incorporate twice a week some sort of strength training, some sort of resistance training, where you are actually like going back to that gym of yours. If you've been vaccinated, maybe you feel comfortable going to your gym again.
I had talked to a doctor, and he said that he'll feel better if I would wait a couple of months for more of the herd, a thing gets into effect. But I think I could go back to the gym.
I think you can too, ma'am. I don't agree. I think the doctor's being too conservative. You've been vaccinated. You're healthy. I'm assuming you're fairly healthy.
I'm overweight. I had lost 65 pounds.
Oh.
I used to go to Whole Foods and eat from the buffet, all their vegetables and chicken. And I lost about 65 pounds in about a year and a half.
Good for you.
Well,
wow.
I put on but I put a 30 of them back on again this past year.
You'll lose it, ma'am. If you've got the intention to lose it, you'll lose that weight again. You'll eat well and you'll start exercising. I would tell you that you can cautiously go back to the gym with your mask on, wipe down all the equipment that you touch, and actually try not to be in crowds, which you wouldn't be anyway if you're walking on a treadmill or on an elliptical machine or on a bike. You'll be kind of secluded away from people, at least 6 feet away. Go to the gym.
I'm going to do that. Thank you so much.
All right, Rose.
You're welcome, Rose.
And that will help with that blood circulation?
It will. And you might still have to wear those compression stockings for a while, depending on how severe it is. But you're not prevented from walking as long as it's not causing you severe pain in the legs.
Right. It isn't. It just itches every now and then, turns red. But other than that.
All right.
Yeah, generally speaking, walking is not going to be a negative thing there. It's not a problem. You should be able to walk.
Thank you so much.
Thanks,
You're welcome,
Rose. Doctor, I'm not much of a runner, but on a treadmill, I like to go pretty fast. I crank it up a little bit without actually running. I'm a very brisk walker, as you mentioned there.
Okay.
Brisk walking's fine, right?
Brisk walking's fine.
Sure. I'm a very brisk walker. One
Just
more phone
walk
call,
a little
doctor?
bit more faster than what's comfortable.
I could do that. I take it up a little notch too with the height or
there you go.
The hill. I go out try to make it 8.0 on the hill. Well, one last phone call. We got time for one more phone call. It's
sure.
Before noon here still. Caller, you're on the air.
Well, I think that things seniors could do more of, particularly now that the economy's starting to open up, and that is do volunteer work. And I think it fits the bill in terms of being socially interactive with other volunteers. If you volunteer at a hospital, you very often get an assignment, like you're in the information desk, so you get to interact with the public at large. I used up to the pandemic hitting, I volunteered at least 2-3 times a week, but some of the organizations just shut down completely, or they took the positions that were they were not that eager to have seniors do volunteer work because they were at high risk type thing, and many seniors didn't want to do volunteer work anymore. But I think another thing that benefits seniors is being mentally active, and that is reading books, reading magazines, and so forth, and keeping up with what's going on in the world, and also watching educational television, travel shows, and so forth. I think that also helps seniors stay active mentally and somewhat physically.
Thanks, Walt.
That's
Doctor, is that true?
Sir. What's your name, sir?
That was Walt right there. He calls
Walter?
Walt. He calls him regularly.
Walt.
Yeah.
So Walt, I mean, you're very, very, astute in what you said. Do you remember I said earlier some of the things that make people happy as they age, and it's been proven, is one, social interactions with people. You mentioned how you want to be socially interacting with people through your volunteering, but also volunteering meets the second criteria, meaning it gives you a purpose. That people who volunteer do so because they want to help somebody. They want to feel like they've actually moved the needle and improved the world a little bit by helping somebody. So when you volunteer, you're helping somebody. You're actually achieving that big point of having a purpose for your life, getting up and having that purpose. But that is very important to be happy. You also said that important to read and do things. Absolutely, when you get older, it's also been proven, right? I mean, having dementia, if you want to reduce the risk of dementia, you want to do things that are going to activate your brain. You want to do puzzles. You want to read. You want to challenge your mind a little bit every day as you get older. You don't want to just watch TV, which is completely passive. TV watching is a passive activity.
Unless
you
it's
have to
Jeopardy.
Make your mind do something.
Unless
it's Jeopardy. That's good. Jeopardy's making you think. I love Jeopardy. Although I feel bad that Alex is not there anymore.
I don't even know what they're doing with that. They have so many hosts in and out. They got to stick with. I thought Ken Jennings was going to get it, but I don't know.
He was good.
Yeah.
He was good he did a short stint on that,
Yeah.
but it's hard to replace Alex Trebek.
Oh,
but look
sure.
at Alex Trebek. He was 80 something, right? He was 85 years old, I think.
Didn't
when he
look
finally died. He had pancreatic cancer, and look how sharp he was.
Right to the very end.
So it's amazing. It just seeing somebody like that's how you want to be when you're that age. So it is important to activate our brains by doing something that challenges us a little bit and makes us think, like Walt said.
Doctor, our time is up, but if people want to know more about you or where you're at, tell the folks how they can get in touch with you.
Yeah, just go to our website. Just Google Midwest Interventional Spine Specialists. I don't even know our www.spinecare.
I tagged the Facebook page, so you guys are, if you want to just check it out, go to Facebook, click on that link, that'll take you
Google
there.
it and you'll find it.
Yeah.
Or Google my name, you'll find my website.
Sure.
You can learn all you need from that.
All right, Doctor, a pleasure. And thanks for joining me here today. I know Jed. Jed's not here, but we were just fine without him, weren't we?
Oh, we did. It was great. It was great. Thank you so much, Tony.
Pat ourselves on the back for a second there. Good job, everybody. All right, Doctor, thank you very much.
Have a great day, Tony.
All right, take care.
Bye.
All right, as we say goodbye to the doctor there and the video right now, again, a lot of good things in there as far as mental health, physical health, all around health. So that's a good thing to keep tab on. And of course, as the weather gets warmer outside, more people going out, you got to get your stretching in before you do any activity. You hear from him, golfing, bowling, basketball, biking. Before you start to do those activities, you got to stretch it out. So always good to hear from him. Again, that was Dr. Sean Kondamuri. For those of you that may be tuning in for the first time, I want to know more about him and what he does and what he's all about. Well, you could always check him out, as he said right there. And, of course, that was sponsored by Midwest Interventional Spine Specialist. Again, this will be on replay, JetTV.com, Amazon, Roku, Apple TV, your Jet TV app.